Do you know your numbers? Dun dun dun!
Hello everyone, this is Nurse Sabrina Clayton here. Listen, I haven't asked you guys this question in a long time. Do you know your numbers? Now, which numbers am I talking about today? Your white blood cell count. Do you know your white blood cell numbers? Well, I want to talk to you about it because it can mean a difference to how well your immune system's working, if your immune system's in trouble, or if it's normal. So, what are those normal ranges? A normal white blood cell count is 4,500 to 11,000 cells per microliter. Okay, this is considered normal for an adult. Normal for an adult. Okay, I have adult written over here. Now this, if your number goes above the 11,000 cells per microliter, it is going to be considered high. So high white blood cell count, I'm going to explain to you what all that means. And if it's below 4,500, then it is too low, considered much too low. Okay, so what does all these numbers mean? Well, stay tuned until the end because I'm going to break down little by little what they mean and what you can do for treatment regimen. And what would your doctor do if you are too high or too low? What type of treatment plan would he have planned for you? Now, I'm going to break down the white blood cells in a simple way. I'm going to break it down and I'm going to try to keep it as simple as possible so that even a little preteen, 13-year-old or even 14-year-old can understand. So I want you guys to think of your white blood cells as little soldiers that are just marching in there to kick out that bacteria and the viruses. They beat them up and they try to get rid of them when they come into your blood. Because I talked to you guys about red blood cells. So the red blood cells are different. But when the white blood cells are in your blood and they're too high, that may mean there's an infection going on or something's going on. Okay? Your doctors will measure your WBCs, which is what we call white blood cells for short, WBC. Your doctor would do a blood test called a CBC, which means complete blood count, okay? It measures everything from your red blood cells, your white blood cells, everything. But with the white blood cells, these are how many soldiers you have in reserves, okay? So they're waiting to go to action. So if you have above 11,000, if your white blood cells are above 11,000, that means your soldiers are out there fighting and they're going to work to kick the bacteria and the viruses out of your blood. Now, why do the white blood cells matter? Well, like I said, if it's too high, that's not good. It just shows that there is an infection, there's something going on. So, it's good in a way because your white blood cells are going to work to combat the viruses and the bacteria. But having too few white blood cells, it just means that your body is not fighting the certain infections or the illnesses very well. So if it's too low and your body and a virus is introduced into your body or a bacteria, you could become very sick. That's why you want to make for sure these numbers are within normal range, that your body is doing what it naturally should do. Now, what causes too low white blood cells? Sometimes it could mean you're taking certain medications that can be causing your white blood cells to go too low, like some people who are on chemotherapy, or if you have certain illnesses or diseases that can affect the white blood cell count. Like some people who may be HIV positive, sometimes their white blood cell count can be too low, so you got to be on top of that, or even an autoimmune disease. So again, having too high of a white blood cell count or having too many white blood cells, it can also mean a sign of infection or a sign of inflammation throughout your body or other medical conditions. A common cold, or having a virus, the flu virus or COVID virus. Any of those can cause the white blood cells to elevate. Now, they may not. You could have the flu or the virus and COVID virus and still won't have elevated white blood cells. But if you add stress to your body and dehydration while you have these viruses, well, then that will definitely elevate this number for sure. So that's why when you get flus or colds or anything like that, they always tell you drink plenty of fluid if you can. If you're not nauseous, no nausea, no vomiting, then try to drink as much fluid so it can keep your body hydrated and keep the white blood cell count within a normal range. Because when you become dehydrated, that number too also can go up. Because with dehydration, you can cause inflammation from that and other stressors to your body, which in turn can affect that number and make it go up as well. If you smoke, unfortunately, smokers sometimes can have an elevated white blood cell count. Not by much, but they say usually it's a wee bit, but still, every little bit makes a difference, and you don't want to mess with those numbers. And trust me, your doctor will tell you if your numbers are out of whack. And if they don't tell you, ask them, doctor, how are my white blood cell count? How are my red blood cells? Ask them about all of it, your magnesium, your calcium, all of that, vitamin D levels, all those numbers are important.
The general term for white blood cells are called leukocytes. And the general term for elevated white blood cells, meaning your blood cell numbers are very high, is called leukocytosis. So this term is definitely when one or more of the white blood cells are elevated. Now, there are different types of white blood cells. You have your neutrophils, you have the lymphocytes, you have the monocytes, the eosinophils, and the basophils.
These are the 5 white blood cells that keep you healthy inside. The neutrophils are the first responders that chase and eat bacteria, and that process is called phagocytosis. And that means they grab the germs, the bacteria, and the fungus, everything that's within your cells, and they eat them up fast. The neutrophils are the most common type of white blood cell in your blood. The lymphocytes include the T cells, the B cells, and the NK cells, which are known as the natural killer cells. They are crucial for fighting all the infections in your body because they help with producing the antibodies that actually fight against these infections. Think of them as the villains that go after these infections and stop them. They make these antibodies and they stop them in their tracks. The monocytes are actually the largest white blood cells in this group, and they help clean up the dead cells and the debris in your cells. They even help your other white blood cells by helping identify and locate these other infections. The eosinophils help fight off parasites, and they help balance out your allergies. The basophils are the least common type of white blood cell, and they also help with your allergic response by releasing histamine. Both the eosinophils and basophils help with the allergic responses, but all of these white blood cell types help with producing antibodies, which in turn will help you fight off all of these bacterial and viral infections. And finally, the medical term for low white blood cell count is called leukopenia, while a more specific term when there's a low number of neutrophils, a particular white blood cell, is called neutropenia. And you may have heard this if you've been in the hospital and you're on neutropenic precautions because of this specific low white blood cell count. And everyone will wear a mask around you and put you in an isolated room to protect you from infection.
Like I said with the inflammation, inflammation from an injury can also cause your white blood cells to go up. We've seen that with patients coming in who have trauma, trauma to the body after a bad injury. It will, like a gunshot wound, stab wound. Well, that's because what's happening? There's a foreign object in your body, and your body is sending those little soldiers there to that area to try to heal that area. So that's why the white blood cells count goes up in those situations. Now, what to do if your white blood cell counts are too low? If your doctor says your white blood cell count is low, here are simple, practical steps you can take with medical guidance. You follow their medicine plan as they prescribe if you're on antibiotics or whatever. You want to protect yourself from infections because if your white blood cells are low, then you're more prone to get sick because you don't have as many soldiers in your body to fight. So make for sure you do proper hand washing. And I say proper, but even if you don't do it properly, any kind of hand washing is great. I mean, get your hands in soap and water is best. If you can't get to soap and water, always keep hand sanitizer. I always keep some in my car, in my bag, because you never know if you go to the bathroom somewhere, if they have soap in that bathroom. How many times have you gone to a bathroom in a restaurant or wherever and they're out of soap? Well, at least if you have your trusted hand sanitizer with you, you can clean your hands. It's best to do soap and water. And it's ironic, during COVID, the pandemic, you were going to the stores and all of the hand sanitizers were gone. All of them. You couldn't find a hand sanitizer anywhere. But then when you go down the aisle where the soap was, there was more soap. I'm like, well, why is there more bar soap than hand sanitizer? Washing with soap and water is much better. Hand sanitizer is great if you can't get to soap and water. So if your hands aren't that soiled and you just need to sanitize in between, you sneeze into your hands and you just want to sanitize, you're getting ready to eat, you can't get to soap and water, okay, that's fine. You can hand sanitize with that. Nothing wrong with that. Better to do that than nothing at all. But every now and then, you've got to get some soap and water in there and scrub and really get those residual germs off of your hands, or viruses, God forbid. During the pandemic, a lot of people chose not to wear masks. So if you go out in a crowd and you got your bare face out, if someone else coughs or sneezes, there you go. You breathe in that virus or bacteria, whatever it is. In situations like that, you definitely want to put on a mask. And I know today not too many people are doing masks anymore. Now, well, I am in the hospital, because, they say you can do certain safeguards like the flu shot, COVID vaccine, all that stuff. But what if you don't like those things? What if you don't want to get the vaccine? Well, then, that's your choice. But if you're not going to get the vaccine, then I recommend you definitely wear a mask because, other people may be thinking the same way. And then if they have a virus, then there you go. You both are passing your germs between each other. So it's just best to put on a mask in those situations, if you can. Some people have shortness of breath issues or breathing problems. So putting on a mask will create more problems for you. And in that case, then, no, just be very careful in the crowds or the companies that you keep. And just remember to wash your hands, especially if your white blood cells are too low. Because like I said, you have less soldiers than anybody do to come in to fight off the bacteria and the viruses. So you got to be mindful of that and make for sure you protect yourself from those viruses, because you don't have as many white blood cells in your reserves to help come in there and fight off the germs that will be introduced into your body. And during this time, you want to make for sure you get enough rest. And like I said earlier, stay hydrated, because when you're dehydrated, it makes everything worse in your body. No matter what's happening, it's going to make it worse. And you want to make for sure you eat a balanced diet. This is the time that you really want to improve your nutrition and do fruits and vegetables, legumes, increase your vitamin C. And a lot of fruits are high in vitamin C, so that would be great to help you in that. You definitely want to avoid contact with people who already have a contagious disease that you know of. If your neighbor says, oh, I have a cold, blah, 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 well, then don't go visit your neighbor. You want to stay away from people who are already actively, somebody who already have an active illness that can affect and compromise your immune system even more. So you want to try to avoid that. And during this time that your white blood cells are low, if you develop a fever, please stay on top of that. And especially if you're taking Tylenol, or should I say acetaminophen, not necessarily Tylenol, that's the name brand, but acetaminophen is the generic name for Tylenol. If you're taking these medications and your fever is not going away, this is when you want to contact your doctor immediately and let them know what's going on, because you don't have these reserves to help you fight off that bacteria or viruses that may come into your body. Your doctor will definitely want to know if you have a fever that won't go away, chills, coughing, your body shivering or anything like that. You definitely want to contact your doctor immediately. Of course, what to do if your white blood cells are too high. If your white blood cells are too high, then your doctor will be, I was going to say should, but they will be looking for the cause of your infection. They will start reviewing your medications, say, well, what type of medications have you been taking lately? And if you're on chemotherapy, they should know that, I'm sure. And not only that, they'll look at other medications that may commonly cause a rise in your white blood cell count, because there are some medications out there that do that. On top of all of that, he or she will do a follow-up on your white blood cell count level. Like say if you went 1 month and they were high, he'll probably put you on a treatment regimen or find the source of your infection. He would check your urine to see if you have a urinary tract infection, do probably a chest x-ray to see if you have some kind of inflammation in your lungs. They'll check all kinds of things. So to come up with a diagnosis and a treatment plan. And what they will do, they will follow up probably within another month or two. Some doctors say, sooner than that, depending on the patient, if you're a cancer patient or whatever. And sometimes they might even advise you to go to the emergency department because, if it's after hours and their office are closed, then they will advise you to come and see us at the ER. Because we get lots of patients coming in saying, well, my doctor told me to get to the ER right away. They'll call you at home and say, look, your numbers are still out of whack. They're not going down. As a matter of fact, this number is going up. Your white blood cells are getting higher. So I want you to go to the ER so we can check out and do more blood tests and see what's going on. At that point, they might even admit you into the hospital, depending on what's going on, if you have an autoimmune disease or anything like that. Now, what I don't want you to do when you see these numbers or hear about these numbers from your doctor, and then you say, oh, no, doctor, I don't want to go to the hospital. I'll take care of it. First of all, don't try to self-diagnose yourself. If your doctor says, well, I'm not even sure what it is, I need you to come to the ER or to the office so we can do more tests. And then you say, no, I have my home remedies I will do. That's great. I mean, there are some home remedies that may work. I've heard of some people using soursop or, there's several natural alternatives that you can do to help, okay, that I've heard through the grapevine or through people. And that stuff is great to take. I would even say take it regularly. If you want to do something that's going to help your immune system naturally, just keep taking it. So hopefully it won't get to that point. But please, I beg of you, if you're already at this point, well over 11,000, or God forbid, some astronomically high number, do not try to self-treat, yourself at home. You're not a doctor. You don't know what's going on. It could be something really serious going on. So you want to go and get that checked out, get further evaluation by your doctor. And then once he gives you a diagnosis or a treatment plan or whatever, then you can continue on with your natural alternatives, your natural remedies. Because there's been a lot of people who tried that route and then things progress even worse. And by the time they come to the ER, it's gotten so bad because they said, oh, well, I tried this at home. Because I've had a few patients tell me that. Oh, I wanted to try this first, but it didn't work. So my doctor said I need to get here. And at this point, either they could barely breathe or whatever. Everything has gotten worse because they waited too long. So do not self-treat yourself. Don't try to self-diagnose yourself with, God forbid, Dr. Google. So many people type their symptoms into Google to see what it is. And now we got Chat GPT everywhere. And everybody's typing symptoms into that and getting Dr. Chat GPT to diagnose them. So please don't do that. You want to follow up and get a medical doctor that has had years of training in school and experience and knows how to do a series of tests to come up and formulate a diagnosis for you. And that can actually get a proper treatment plan for you. All that said and done, you need to know when to seek care. Like I said, when it gets to that point, you need to seek care. If your doctor's calling you at home saying, get to the ER, get medical attention, get to my office, do it right away. You seek medical care if your fever is out of control or it won't go away no matter what you're taking. It's getting higher and it's getting worse, or you have a pain in your body that's not going away. It's becoming progressively worse. Or you have like these repeated infections that won't go away. Some people say, oh, I just keep having these urinary tract infections. I had this one patient that every time she came around, she would come around like every month for a urinary tract infection, one after the other. And it's like when we did the blood test, her blood cells were through the roof, so don't even take any chances with that. You want to seek medical care right away. And sometimes you're just not feeling well. You have moments where you're just unwell. You're like, I just don't feel well. And then you find out you have a fever or whatever. All kinds of stuff is going on. You want to seek medical advice at that point. Call your doctor or come to the ER, one or the other. So please know these numbers. And if you don't understand them, have your doctor break it down. Whatever your number is, just say, doctor. If it's not in the normal range, just say, what could it be? What's going on? Should we do more tests? Feel free to be proactive with your own care and ask plenty of questions. And I always tell my mom and my dad, like, if you're going to a doctor and you don't think you can remember to write something down, ask your doctor, doctor, would you mind if I record this? I've even been on the other end of the phone when my mom has gone to her doctor. And she goes, if you don't mind, doctor, my daughter is on the line because she wants to hear this appointment. She wants to ask certain questions. So I'm on there. She has me on speaker. Her doctor's talking to her, going over her treatment plan or whatever's going on. And I'm asking questions like, okay, so what is our next step with this? What about this? What about that? Feel free to do that. Have a trusted family member on the other line to ask the questions for you if you don't think you can remember. And, if you don't want to write it down, just ask if you could record it or if you have a trusted family member or friend on the other end of your phone to ask those questions for you. So anyway, I hope you found this information helpful. If you did, click like and please share it. Share it with a family member or friend who you think could use this information. I try to keep it as simple as possible, like I said, because sometimes as medical professionals, doctors and nurses alike, we tend to talk over people's heads. So I try to make it as simple as possible. And that's one of the reasons why I have the YouTube channel too, because I wanted to start a channel that I can actually do a little education to the community, to people who may not understand and just want somebody to break it down for them, or maybe they feel too afraid to ask the question or, I don't know, whatever the reason may be, but hopefully you found it helpful. This has been Nurse Sabrina Clayton. I thank you so much for your time. Thank you to my subscribers already. I really appreciate you. And I welcome all the new subscribers. Thank you. So anyway, I hope you have a great day. Thank you. Thank you for watching. And remember, if you're healthy, you're wealthy. Enjoy your day. Bye.